The new Illumina 3D programming makes it a lot easier for you to feel comfortable programming DBS. It has an algorithm that helps generate patient-specific stimulation plans, and it also is easier to adjust, and it's much faster in the clinic for both the physician and for the patient, because we know that general neurologists do not have the same amount of time to spend with their patients than a movement disorder specialist in an academic setting may. I actually started programming DBS through Boston Scientific because of image-guided programming. It allowed me to see where the lead was, and then I could understand, okay, here's where the lead is, here's the structure that I'm stimulating, here are the structures that I need to avoid, and then I could see where the stimulation was in my patient. And it was a lot easier than the older units where you have the lead, but you don't exactly, you know which structure you're in, but you don't know exactly where the lead is implanted. And the lead isn't always going to be in the same place. And that has to do with the fact that not everybody's anatomy is the same. Not all surgeons are the same. So it's helpful for me to be able to see where that lead is, understand, okay, I'm going to need to adjust the stimulation based on where this lead is implanted, rather than having to do it blindly. This is a beautifully placed lead. This is actually, in my practice, what made me feel more comfortable. I could see where the surgeon had placed the lead. I could actually see where the stimulation was being provided, and that helped me to understand from an anatomical standpoint how the deep brain stimulator was working. Now, this is a really fancy program because the computer has all the nice mathematical calculation that we don't really have the ability to do easily. Basically, what the Illumina 3D does is it allows you to select the target anatomy, the structure that you want to mostly focus on, and then you can avoid regions that you need to avoid based on side effects or dyskinesia, other symptoms your patient may be having. And then the algorithm itself will come in and make this specific to the patient, and it's much easier than trying to go in and do this yourself. It basically gives an outline of the way that the stimulation should be set for the patient, and you can go in and just adjust accordingly from there. This is a slide that shows you the Illumina 3D programming in action. And this is an essential tremor patient. So essential tremor, we put the DBS lead into the VIM, and then the Illumina 3D slowly and gradually will go up to the stimulation settings. But the nice thing about the Illumina 3D is that when it provides the stimulation, when it does its setting, it's a really smooth sort of adjustment versus sometimes, in my experience, people feel much, much more comfortable and you can adjust faster, which is really nice. You can see in this video how quickly the tremor abates.